So as I mentioned in my previous video, um, this is tazocin. So this is a brand from Pfizer, which is a combination of piperacillin and tazobactam. So piperacillin is a penicillin, and tazobactam is a beta-lactamase inhibitor. So indications include lower respiratory tract infection, complicated and uncomplicated urinary tract infection, intra-abdominal skin and skin structure infections, bacterial septicemia, polymicrobic infections. Okay, it can be used in combination with aminoglycoside. Okay, example like gentamicin for bacterial infections in neutropenic adults or children. So this can be given in slow intravenous injection or infusion for adults and children. Let's look at the contraindications. As usual, the contraindications include hypersensitivity to penicillins or cephalosporins or beta-lactamase inhibitors. Special precautions not to be used in patients with known hypersensitivity to penicillin. Discontinue use if allergic reactions or bleeding manifestations occur. Hemophagocytic lymphohistiocytosis. Antibiotic-induced pseudomembranous colitis, overgrowth of non-susceptible organisms, superinfection. Closely monitor and discontinue use if lesions progress. Perform periodic assessment of hematopoietic function. Periodic electrolyte determination in patients with low potassium reserves or patients taking medications lowering potassium levels. Prolonged and high dose and also concomitant use with vancomycin, and then patients with hemodialysis, patients with renal impairment, and then patients who are pregnant or lactating, children under the age of 2 years, and elderly more than 65 years old patients. So we have to take more precautions with this kind of patients. Adverse reactions, diarrhea, okay, as usual, candida infection, thrombocytopenia, anemia, insomnia, headache, abdominal pain, vomiting, constipation, nausea, dyspepsia, rash, pruritus, pyrexia, injection site reaction, increased ALT and AST, blood creatinine, alkaline phosphatase and urea, reduced total protein and blood albumin, positive direct Coombs test, prolonged APTT. Interactions, okay, include prolonged neuromuscular blockade, okay, with vicuronium, okay, which is a non-depolarizing neuromuscular blocker, reduced methotrexate excretion, longer half-life and lowered renal clearance by probenecid, increased risk of nephrotoxicity with vancomycin, and perform appropriate coagulation tests with concomitant heparin, oral anticoagulants, and other drugs affecting blood coagulation, false positive glucose urine tests. So these are some of the potential drug interactions. Locally, we have another brand, okay, which is called Tapicin. Okay, so Tapicin is from a small company, of course, much smaller company compared to Pfizer, which is an American big pharma company. YSP is it's a small company. So otherwise, I think everything should be quite similar to each other. Okay. So in the adverse reactions, it's mentioning phlebitis, thrombophlebitis, diarrhea, rash, erythema, pruritus, vomiting, allergic reactions, okay, and all the other things that are common and uncommon, they're all included, and the interactions are quite similar as mentioned for the drug by Pfizer, tazocin. Okay, I think that's all for today. So this is a little bit on piperacillin. Okay, maybe next time this is a bit about piperacillin plus tazobactam. Okay, so maybe next time we might talk a little bit more on tazobactam and the other beta-lactamase inhibitors that are used to overcome bacterial resistance to the beta-lactam antibiotics.